Okay, welcome to the lobby. We are going to show you the proper way to draw blood on the antecubital area. So first things first, you want to wash or sanitize your hand before you put in the gloves. You want to identify your patient, get their name, date of birth, make sure that's correct. Ask if the patient's been fasting, if they have a history of fainting while having their blood drawn. Ask the patient if they are on Coumadin or any blood thinner medication. That indicates to us that we need to make sure that we hold pressure longer and that the patient can bleed for a period of time longer than normal. It also lets us know to make sure that we use Coban to wrap the patient up so that they are not bleeding after the draw. Sometimes it could stop bleeding and then bleed out later as they're ready to walk out to the lobby. So that assures us that we need to wrap the patient really firmly with the Coban before releasing them. So again, name, date of birth, ask all the questions you need to before pursuing. Patient gives us consent by placing his arm out. We're going to begin looking for a vein. Apply the tourniquet 2 to 3 inches above the site. Locate my vein. I'm checking for the depth of the vein and the location. Check with only these 2 fingers because they are the most sensitive fingers that we have to feel for veins. This one has a pulse, so we don't want to use that one. We don't want to be massaging. We are to palpate. Okay, push firmly, especially if they're obese. You want to go a little more firm and have their arm bent a little bit more than normal. I located my vein. I see a landmark there. We're going to pretend it's like a mole. A landmark is like a mole, a dot, a freckle, something to help you identify on where you're going to go. Wipe up and down. As that's air drying, we do not want to fan or wipe it to dry. We are going to put our tools together as that is drying. I have my 22 gauge. We'll unscrew the cap. Careful because there is a needle at this other end, as you can see. So you want to be careful when putting together your tools. Screw it on nice and tight with the hub. This is already set, so you don't need to look for the bevel. The bevel's already set for you on these needles. This is the safety device that we are going to use one hand to cap it. We are not to use 2 hands to cap. It's 1 thumb, and all we do is cap, 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 cap. Okay. Now that my needle's ready, I have all my supplies I'm going to use. I'm going to reapply the tourniquet because now we're ready to go in. Remember, the tourniquet can only be left on for 1 minute or less. Now I'm going to pull my safety back, open up my needle, anchor the vein, and go right in. Get my SST. The idea is to make sure you are seeing the clear side and not this side, the label. We want to see the clear side. We want to make sure we're getting blood out of that vein. That way you are not turning the needle. Your hand is staying sturdy. I'm resting my hand on the patient's arm. That way it keeps the needle very sturdy. And I'm going to use my thumb to grab the tube out. I'm going to invert. Grab my next tube, which is the lavender. I'm going to use my wings, other known as phalanges. Insert the tube. Sorry guys. This is dummy use. We use it several times, so a lot of times the tube sometimes won't always stick in there, and plus if there's air, there's no veins that work on this dummy's arm anymore. So again, just a demonstration of more of a safety. Alright, that's getting nice and full. We're going to remove the tourniquet. Pull this out, invert, get our gauze, get ready to cap, pull the needle out, cap like this, have the patient hold pressure. Thank you. As the patient's holding pressure, I'm going to be writing the 5 identifiers on there too. Last name, first name, date of birth, date, time, my initials. Okay, we're going to check on that bleeding. How are you doing? Oh, good. The patient stopped bleeding. Time to take them out. Instruct the patient to leave this on for 10 to 15 minutes. Okay, now that's done. I'm done writing the patient's information on the tube. Can you please verify your name and date of birth is correct? Yes. Thank you. All right. And that is it.